What's up, everybody, and welcome to Titan Medical TV. Tonight we're going to talk about blood work and why it's so important for you to get your blood work done and why most people don't get their blood work done. So we're going to start with why it's important. Now, many times we don't feel on the outside what's going on the inside. We don't see it on the outside, we don't feel it until something is drastically wrong. Until there's something wrong with your kidneys, your liver, some kind of system malfunction is going on, then you really start to have side effects and effects that you're feeling. You wind up in the hospital and the doctor's like, well, how could this happen? Have you got regular blood work? And you're like, yes. Like, no, you didn't get regular blood work, and they know you didn't. But you have to check your liver, your kidneys, your cholesterol, all of these things, blood pressure, all of these things need to be checked on a regular basis to tell what's going on inside your body, okay? If you're not getting these checked, you don't really know what's going on, and just literally say, well, I'm fine. Believe me, you're in denial. I've been there myself many times, and the reason why I was there, why I was doing my blood work, this is why. Many times, people skip their blood work for, years at a time, because many of them go into the doctor or their, their general practitioner or whatever they go into, and they have a physical and they go get blood work done, and they say, here's the deal, I exercise 7 days a week, 3 times a day, right? And the doctors automatically freak out, it's too much, you're gonna die, like they get lectured, right? So a lot of times they don't even like to go to the doctor because they're gonna get lectured just on how much exercise they do. On top of that, if you're a person who uses anabolic steroids or any kind of performance enhancing drugs, when you walk into the doctor's office, right? If you tell them right away, no matter what they find wrong with you, they automatically blame it on the steroids, right? But if you don't tell them when you go in there and you do the blood work, when you get the results back, they go, holy, like your cholesterol is crazy, right? Your liver enzymes are way up, your kidney function is impaired, like your blood pressure and your hematocrit level, everything is just out of whack. Like you're really unhealthy for being so young. And then you say, well, doc, this is what I'm doing, and this is why, because it's the side effects. And many of the doctors not only look down on you because they don't like those drugs whatsoever. You know what? I don't blame doctors for not liking things that cause people harm, but they will literally start to lecture you. They actually make you feel bad about the decisions you made. They make you feel bad about what you're doing, and nobody wants to be talked down to, made to feel stupid, or be lectured for any reason whatsoever, especially from a doctor standing there in front of you trying to let you know how bad you have screwed up, right? There are also doctors that literally won't even help you. Like I know of doctors that literally people have told them, this is what I did and I don't do it anymore, but my body won't bounce back. A perfect example is testosterone. Many times guys use testosterone for years and years and years for bodybuilding or whatever the case may be, and their bodies don't produce it anymore. So now as they go to a doctor, I've actually had people that I know go to the doctor and their testosterone was so low that it was almost below the chart that it was supposed to be on. And the doctor told them, well, you did this to yourself, so you kind of have to deal with it now. He was like, but I see commercials on TV for low testosterone. He's like, well, that's for people that naturally have it, not people that did it to themselves. So a lot of doctors, they automatically have this kind of judgment for you when you walk in the office, and they automatically will not help you based on what you've done in the past. Where in the medical field, the rule of thumb is your patient comes first, which means you walk in the door, it doesn't matter what you did to get there, they need to treat you right then and there for what's going on now and help you. That's what you're there for. Doesn't matter what you did, right? What matters is what's going on right now. So due to that fact, a lot of people don't get blood work done because they don't want to be lectured, they don't want to be talked down, they don't want to be feeling stupid about some decisions that they may have made 10 years ago and their body's still not producing testosterone, whatever the case may be. And it leads to bad things because now it leads to either they continue using the drugs, mess themselves up even more, or their body never bounces back and their quality of life is just terrible. So now what happens is you enter Titan Medical. Now I'm so glad they found Titan Medical. So Titan Medical will not turn you away because you did something in your past. Their job and their goal is to get you healthy, back on track, feeling better quality of life, and making sure that you stay there so you don't have any complications, wind up in the hospital, wind up with different side effects. Their job is to make sure that you're healthy. They will do the blood work, get the blood work done. You'll go through the doctor there. You'll have a Skype, which is a face-to-face meeting with the nurse practitioner and the doctors over all your blood work, tell you what's going on, and the doctor will decide course of action based on what they think is best for you. But what they're not going to do is when you walk in there and say, I haven't taken anything in 3 years, no, I don't know what's going on. They're not going to be like, well, bad, you, shame on you, no. If you walk in there and say, well, I haven't had blood work done in 5 years, but I eat 5 bags of pork rinds and drink alcohol every night, that's why my liver is kind of messed up and I have fatty liver. Like, they're not going to go, shame on you for doing that. They go, look, really have to change this stuff. But here's the deal. This is where your level's at. This is where you need to get them at. These are some changes you make, and the rest is kind of up to you. But they're not going to judge you, make you feel bad, or in any way make you feel dumb for any decisions you made before you got there. Like, their main goal is to make sure you are okay, healthy, and you're going to live a long, fruitful life. That's their goal. So in closing, guys, make sure you get your blood work done. Again, I in the past have been the worst one with not getting my blood work done because I didn't want to be talked down to. I've actually had doctors tell me, like, look, come back when you're off this stuff. I don't even want to talk to you anymore because I don't want to be responsible, things like that. And I wasn't even I mean, it's just crazy the things that some doctors have actually told me and friends of mine. And I'll be honest with you, like, as soon as I met Titan, they were warm, they were outgoing, they understood. That was the thing, is they understood it doesn't matter what you did. This is where you're at now, and we need to get you healthy. And that's the key word, healthy. So I appreciate you guys for listening. Thank you very much. I'm BioStreet, and I approve this message, and we are